This week, I had the most spectacular accident. I fell backwards out of the trunk of our station wagon, head first, legs up. Broke the fall with my arm, and then came that unpleasant crunch. Fortunately, the car wasn't moving. I was just clumsy. So, painkillers in, partner driving, 5 minutes later, hospital. We hobbled to the front door. I didn't hurt my legs, just wobbly from adrenaline. And what do we see? A sign. Emergency room closed, Monday to Friday, 9 to 5. Yeah, apparently emergencies keep office hours. My first thought, ugh, this is so Dutch. Looks like a first world country, but nothing works quite the way you expect. Will this happen in Taiwan? Or in the US? Let me tell you, the answer may surprise you. Hi, I'm Seriously, Taiwan Matters, Taiwanese American living in Europe. These are my guinea pigs. Their vet bill was the most expensive healthcare we've paid in a while. Back to the closed ER. We're panicked, ready to speed to another hospital. Then I think, wait, this is insane. This whole place is open. What's the secret handshake? We call our family doctor. Within minutes, radiology at the same hospital is ready to receive me. X-rays, sling, meds, follow-up. Done in an hour. All covered. The trick is having a great family doctor. A lot of foreigners complain, but they just pick the wrong clinic. We ask our pickiest neighbor for advice and never look back. Once you're in, the system opens up fast. Convenience, honestly better than both the US and Taiwan. Doctor's office 2 blocks away. Same or next day appointments. Free meds. Once I had a scare. My doctor called the hospital during my appointment, and I was with a specialist before my partner could bike there. Insurance, about 200 euros a month per person. Employers usually chip in. Kids are free until they turn 18. And the best part? All 27 EU countries provide universal health care, plus a few not in the EU, like the UK, Switzerland, and Norway. If you're insured in one, you're covered for emergencies in the others. One card covers the continent. Even visitors not from Europe get a good deal. My mom once saw our doctor for 45 minutes, paid 32 euros. A doctor with years of training charges less than someone painting your nails in the US. The biggest downside for me is that some preventive care that's usually done annually in the US or Taiwan are only done every 5 years in the Netherlands. So if you're a hypochondriac or just need more peace of mind, maybe Taiwan is your place. Taiwan's national health insurance since 1995 is ridiculously cheap. Under 65, less than $30 a month. Over 65, free. Doctor visits, about $20, meds included. Sometimes there are extras, like $130 for my mom's cataract surgery. Still cheaper than a checkup in the US. What about the quality? Honestly, world class. Public satisfaction is above 90% since 2020. But it's busy. Nurses are underpaid, doctors overworked, and a big-name specialist? Forget it. My cousin once saw a famous dermatologist. This is how it went down. 10 patients are called into the room by their numbers. Form a circle, doctor in the middle. Shirt up, pants down. Show the doctor what you've got. He prescribes, move on to the next. Men, women, all together. I asked, what if it's private? She said, well, then find another doctor or grow a thick skin. Another issue, because drugs are usually free, people get them from doctors even when they don't intend to take them and just hoard them. My uncle has so many extra Lipitor pills that if you ever mention cholesterol at his house, he'll casually offer a few right next to the pineapple cakes. Still, Taiwan is impressively efficient. According to the Commonwealth Fund, only 1.6% of health spending goes to admin costs, compared to 15 to 30% in the US. That money goes into actual care instead of paperwork. Now, America. Fancy, powerful, cutting edge, but a nightmare to pay for. Wall Street Journal says Americans spend around $4,000 a year on health insurance, but that includes employer subsidies. On your own, $600 a month per person is common. And even with insurance, meds and tests are expensive. Access, slow. Family doctors, 1 or 2 weeks for an appointment if you're lucky. My brother's dermatologist, 15 months wait. By then, your rash has learned to walk and say its first words. But once you're in, quality is high. Hospitals follow strict protocols, partly for care, partly to avoid lawsuits. ERs, a nightmare. I've been to 4 in 20 years for family members. Always hours of waiting, plus bills in the thousands. Once we left after 5 hours with a head injury. The blood dried, but no doctor came. At that point, you're not sure if you should feel lucky it's just your head or wish you'd also lost a limb to move up the list. And some ERs get clogged with uninsured patients who can't afford regular doctors because it's the only place that can't turn them away. So, despite brilliant doctors and amazing tech, the US system is in trouble. The silver lining of my accident, feeling safe in Europe's healthcare system. Taiwan's would have been just as good, maybe with bubble tea while waiting, and the nurse might even order one for you. The US? Let's not test that. For now, I'll try not to test any more healthcare systems. One broken arm is enough research. Please subscribe and check out our other videos.